From the JAMA Network, this is JAMA Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinion featured in JAMA.
Welcome, and thank you for joining us for this JAMA Author Interview podcast. I'm Dr. Tracy Liu, Senior Editor at JAMA, a pediatrician, and Director of the Division of Research at Kaiser Permanente, Northern California. Today, I'm very pleased to welcome Dr. Amanda Graham, author of an exciting new randomized clinical trial in JAMA titled A Vaping Cessation Text Message Program for Adolescent E-Cigarette Users. Dr. Graham is the Chief Health Officer at Truth Initiative and Adjunct Professor of Medicine at the Mayo Clinic College of Medicine and Science. She is a behavioral scientist with a PhD in clinical health psychology. For 25 years, her research has been funded by NIH and is focused on technology-based tobacco cessation interventions. Dr. Graham, is it okay if we go by first names?
Absolutely.
That's great. Would you say a few words about the Truth Initiative?
Sure. Truth Initiative is a national nonprofit public health organization that is committed to a future that is free from lifelong addiction to nicotine and tobacco. We have really a twofold mission. The first is to prevent youth and young adult nicotine addiction. And then second is to help people of all ages to quit successfully whatever form of nicotine or tobacco products they're using. Our work centers around 4 programmatic areas: rigorous tobacco policy and surveillance research, national public education. Most people know us for the Truth campaign that we've run for over 2 decades, tobacco control advocacy, and the work that I lead, developing and optimizing innovative digital tobacco cessation interventions that we run nationally as part of our public health mission.
Tell us why this study is important at this point in time.
So back in 2019, vaping rates really hit their peak. That was when roughly a third of high school students reported current e-cigarette use. Many of them were using e-cigarettes regularly, a cutoff of what we typically measure as 20 or more days a month. And that was really when the Surgeon General declared e-cigarette use among young people as a public health epidemic. What we were seeing in our work at Truth Initiative were scores of young people all across social media talking about wanting to quit, looking for help quitting, and not knowing where to turn. There just wasn't any specific vaping cessation resource available. So that's the space that we stepped into. My team at Truth Initiative has a wealth of experience running digital tobacco cessation programs, largely focused on smoking cessation. We've done this work in partnership with Mayo Clinic over the past 15 years. And so we really took that expertise and developed, I think, what is the first quit vaping program specifically for adolescent and young adult e-cigarette users. The first evaluation that we did was among young adults. That showed the program to be effective among 18 to 24-year-olds. And this study really builds on that work and is the first trial of a vaping cessation program among adolescents.
So yes, let's talk about your trial. Can you tell us how you recruited adolescents and how you developed the intervention?
Sure. So this was a nationally run study, fully digital. We placed ads where we know young people are, so on social media platforms like Instagram and Snapchat. The ads talked about the opportunity to quit vaping with support and brought them to a study website that presented information about the trial, explained what their participation would involve. I say it's fully digital because the process of recruitment all the way through informed consent, through randomization, and then treatment assignment was all done digitally. Typically, research with adolescents involves parental consent, and yet what we know is that can be a barrier to participation. Many adolescents don't disclose substance use. They're reluctant to involve parents in the trial process, and we were able to obtain from the IRB a waiver of parental consent, which was really a key piece of our ability to do this trial.
Can you tell us how you developed the intervention?
Sure. So our first decision was really deciding what modality to use to engage young people. And text messaging very clearly became the obvious choice. It's nearly ubiquitous among young people. There's nothing to download or install. It comes native on every phone. And we know that adolescents are very intensive text message users. We then reviewed the scientific literature on smoking cessation, clinical guidelines, made sure we were grounded in behavior change theory. User-centered design is a key part of our treatment development process. We take kind of an iterative approach to make sure that we're testing different elements of the intervention as we're developing it. And a really key piece of this work was one-on-one interviews and focus groups that we did with adolescents, with young adults, current e-cigarette users, former e-cigarette users, to really understand what's unique, what is specific to e-cigarette use that may be different from other tobacco products.
What did you find?
One of the key things that came out is really the importance of peer support. We know this from the literature that positive support, that peer influence is critical. How to do that in a digital intervention really required some creative thinking. And what we did was to create a mechanism right from the outset when we launched this program that allowed young people to submit the tips, the advice, the guidance, the encouragement that they would offer to somebody else who was quitting. They could provide a username, they could provide their first name. And we've taken those quotes or suggestions from young people and really folded them all throughout the program. And what that conveys to other young people is they're not alone in quitting. Other people are quitting. Other people are being successful in quitting. And we've really been able to normalize the process of quitting, the ups and downs.
Great. Tell us about your study's findings.
The key finding was that participants who were randomized to the intervention arm were about 35% more likely to report no vaping at that 7-month follow-up. This was a measure of 30-day point prevalence abstinence. That's a self-report that they had not vaped even a puff, even on somebody else's device in that 30-day period. And in the adolescent literature, that's really a marker of what can be predictive of long-term success. There was about a 10 percentage point advantage for the treatment arm. And really what's most exciting to me is that we found that none of the baseline characteristics moderated that treatment effectiveness. None of the subgroups that we looked at, whether they were defined by demographic characteristics, whether they were defined by nicotine dependence. We had a number of measures of psychosocial adversity. The program outperformed the control intervention consistently across all those subgroups.
So these are some very robust findings, I would say.
They are. Yeah. And we were also able to include data on some of our combustible outcomes. These were secondary outcomes that we measured, and it included use of cigarettes, cigarillos, little cigars, large cigars, other combustible products. There's often a concern that you get kids to quit vaping, and are they simply transitioning to other more harmful products? And so that's the reason we included those in our measures. And even though the intervention didn't focus on quitting combustible products, what we found was that there was no evidence that kids quit vaping and switched to smoking or these other combustible products. The intervention was also effective in reducing dual use in this sample.
It's really interesting that your intervention was not just effective in certain subgroups. Can you comment on how representative your study population was? Was it a diverse sample?
It was a diverse sample, diverse by both race and ethnicity. We also had an overrepresentation of adolescents who reported being part of a sexual minority group, lesbian, gay, bisexual, or queer. There were very few eligibility criteria. Adolescents had to be between 13 and 17 years old, have access to a mobile phone with a text message plan, and be interested in quitting. And so when we think about the population that these findings are most generalizable to, what we know is that most kids have a cell phone, have a text message plan, and they're interested in quitting. And so we really feel like the generalizability of this design is quite high.
Great. As a wrap-up, what take-home message could you offer for physicians and other clinicians who work with adolescents?
We know that pediatricians, other healthcare providers have really been eager to have a resource to share with the patients that they treat. And the importance of this study is that now, for the first time, there's a proven program that they can refer their patients to. Obviously, time with a patient is time limited. they can ask, advise, and certainly refer to this program, which is freely available, nationally available, and can really support young people through multiple quit attempts for as long as it takes to quit successfully. We have an easy to remember keyword that physicians can recommend, which is ditch vape, that a young person texts into 88709, which is the short code for the national program.
That's terrific. Amanda, thank you so much for this wonderful study and for developing a tool that will be useful to physicians and other clinicians around the country.
And thank you to you and to the editorial team for your partnership in this.
I'm Dr. Tracy Liu, and I've been speaking with Dr. Amanda Graham about her randomized trial of a vaping cessation text message program for adolescents. You can find a link to the articles in this episode's description. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Musisi at the JAMA Network. Thanks for listening.